Welcome to the show discussing problems and issues of health with Dr. Alcena. For this segment of the show, I'm going to continue to talk about bleeding disorders in the human body. Now, bleeding disorders are very, very, very common, and I presented the list to you all in the last two shows, and I've completed a show last week on Van Willebrand disease, which is the number one bleeding disorders in the world, and I went through all the whole process on how to evaluate the patients, how to treat them. But one thing I forgot to say is the fact that though I pushed the idea of doing bleeding time forward, you got to be very careful because before you do the person's bleeding time, you have to make sure that they had been off aspirin for 7 to 10 days, also have been off any one of the NSAID for about 24 to 48 hours, because the half-life of the platelets that the quality of which you're testing on the half-life of the NSAID on the platelet is basically 6 hours, but to be on the safe side, we tell people stay off it for a couple of days before we do surgery. And for aspirin, it's of course 7 to 10 days. So keep that in mind whenever you're doing the bleeding time, which is a great test to do. You must make sure that the patients you're going to test have been off these two families of medications. Now, in this segment, I'm going to talk about another disease of bleeding that is not quality of the platelet. This time is the quantity of the platelet, and namely, that is ITP, idiopathic thrombocytopenic purpura, or the new name for it is primary immune thrombocytopenia. Okay, now, this is a disease that, according to the literature, affects 10 million people worldwide. And in this country, every year, 30,000 folks are diagnosed with ITP. ITP develops in both children and adults. And children, most of the time, if not all the time, it resolves itself spontaneously without any medical intervention by way of medication, etc. An adult, of course, is an entirely different story, very complicated. Now, the literature say 10 million folks. I have a question mark about this, and the reason being there's another disease called H. pylori gastritis, which affects half of the world population. The world has 7+ billion people, and 50% of them are affected with H. pylori. And H. pylori is a microbial organism, a bacterium that one gets infected with through the oral fecal route, through food or water contaminations. And of course, in the developing world, the sanitation being so poor and the crowding, many folks living in one house with no toiletry in terms of ability. There is no toilet, there is none of this stuff. And people don't have access to washing their hands after they have a bowel movement, etc. They wind up contaminating themselves with this organism. In this country, 30% of the U.S. population are affected with H. pylori, infected by it. In New York City, 70% of the New York City population are affected by the H. pylori bacterium, because you have people from all over the world living in New York City, from developing world as well from the developed world, etc. So it's very, very common infection. Now, I'm making the point because, again, according to the literature, 52% of these people who have H. pylori infection develop ITP as well. So ITP can be found in 50% of people who have H. pylori infection. In fact, frequently, this is how it presents first. Now, adding to that, it is also the number one cause of bleeding ulcers, ulcer of the stomach. That's why H. pylori is the number one cause of bleeding ulcers of the stomach. In the developed world, where folks have access to the H2 blockers such as Zantac, Tagamet, and etc., and or the PPI such as Naxium, omeprazole, etc. So they're less likely to have bleeding ulcers. In fact, bleeding ulcers has diminished so much so that we don't see people going to the OR to be having partial gastrectomy anymore because of bleeding ulcers, etc. It does occur, but it's a rare thing. And when it does occur, when the people do develop the ulcer, we treat them with the PPI or the H2 blockers, and we heal the ulcer that way. To complicate matters even more, in this country, between 45 to 50 million folks takes a baby aspirin every day. Now, I just finished telling you 30% of the U.S. population have H. pylori infection, and 52% of those who have H. pylori infection can develop ITP, according to the literature. And then when you add to that, all these people take an aspirin. And as I stated before, I'll say it again, aspirin is a fantastic medication. I take a baby aspirin every day myself. But you have to have a physician who's advising you as to when it is safe to take aspirin or NSAID or not. You can't just go and take this thing on your own. I mean, you could do whatever you want, but I'm making the point, when you have the possibility of all these people having all these underlying bleeding problems, and then on top of that, they're going their own, they don't know they have this problem, because most of the time, people don't know, and I'll begin to tell you the symptoms of ITP in a little bit. And you're taking these things, the next thing you know, you start bleeding. When you start bleeding, if you have underlying kidney problem, that can make it worse because you drop your blood pressure. If you have underlying atherosclerotic disease resulting from high blood pressure or high cholesterol, you could have a stroke because you drop your cardiac output, you can't perfuse your brain, or you could have a heart attack. Or for that matter, if you have coronary artery disease and pretty stable congestive heart failure, the fact that you start bleeding, you become ischemic acutely, you go into congestive heart failure, you could die that way. So these are very, very serious things that obviously people who are not physicians are not aware of what they're doing to themselves. It is hard enough to diagnose and treat the diseases that people have. And then when they create these major complications, it makes the whole business that much more difficult to deal with. Okay, so ITP. Symptoms of ITP, the earliest ones. By the way, let me get into the science of ITP first, okay? I don't want to forget that, the mechanism. I'll say it and I say it again. You really cannot understand these things unless you understand the science. The same way you cannot build a house without proper foundation. If you do so, the first 50 mile an hour, 200 mile an hour wind that is going to knock it out. Of course, 20 that's powerful. I'm talking about, you don't need a hurricane. I'm talking about, the point I'm making is that if the house is not built with good foundation, it's going to get knocked over very easily. Well, the same is knowledge. If you don't understand the basic of knowledge, then not only that you don't know what you're talking about, you're going to put your foot in your mouth because you don't understand the basic of it. Well, this is the basis for ITP. It's an autoimmune condition of unknown cause. There are many such diseases that are of autoimmune nature, and they're all over the place, hundreds of them. What it is that the body reacts against itself. Something happened, and children, or for that matter, an adult, ITP comes about usually after the measles, the MAPS, or an upper airway viral infection, etc. But most of the time, there's nothing preceding it. It just, in fact, most people don't even know they have it. So this autoimmune phenomena, the body is reacting against something that is foreign to it. So what's foreign to it is the fact that because of the reaction, the antigen-antibody reaction that's occurring, then you have an attachment of an antigen that stimulates the production of an antibody, and the antibody and the antigen are complex together. And this complex of material then cover the top of the platelets, which is a cell that circulates in the body. And then as that happens, the rest of the cells in the body, such as cells that are in the spleen, in the liver, and all the mononuclear cells, we call them scavengers. Their role is to remove things that are foreign to the body as much as they can to filter it out. So now the platelets, heretofore that were normal, suddenly become abnormal because they're being coated by this complex of antigen antibody that resulted from this autoimmune phenomena that you had nothing to do with. You didn't do anything wrong. This is your body. That just happened. As soon as the platelets become a foreign substance, they have to be taken out. They'll be taken out by all the parenchymal cells, all the reticuloendothelial cells, and all the mononuclear cells. Believe it or not, even the monocytes, they can use for that purpose as well. So that swallowing these things, take them out because they're trying to cleanse the body of this foreign substance. And so doing, they drop the platelet count. So that's the science. That's what ITP is. Okay, so now you drop your platelet count. The normal platelet count is from 130,000 to 400,000. And the platelets, by the way, are produced by a cell, are made by a cell called the megakaryocyte, which are the mother cells that are found in the bone marrow. You don't find megakaryocyte in the circulation in a normal sense. They are located in the bone marrow. If you want to know what the bone marrow is, the bone marrow, all along bones, your arm, your legs, your hips, all these inside that cavity is where the bone, what's inside the cavity of the bone is the bone marrow. And a good example of that, when you cook a chicken, you're eating the chicken, when you look at the bone that you're eating, inside it you see the thing that's, the bloody material that's kicked up inside the bone, that's the bone marrow. That's where all the cells are made. We have other places where cells are made in the body. I'm not going to bother you with that. That is too refined and it's just too complex to go there. I'm not going there. But grossly speaking, all the cells that circulate in the bloodstream that we could see under the ordinary microscope, they're all made in the bone marrow. Okay? So that's where the megakaryocyte is. And it produces the platelet, dump them into the circulation. The platelets are there to help you to clot. They're the first line of defense when you get caught. That's the first thing that comes to your aid is the platelet. One single platelet run toward the cut that occurs and stick there, and the next platelet stick to it. Once the next platelet stick to it, you have a clumps of platelet that then begin to produce a material called thromboxane A2, which is a platelet it's a vasoconstrictor. That material then creates the fuel that the platelet needs for more of them to clump together, okay? And when you take an aspirin or any one of those NSAID, the idea is to prevent the clumps from occurring because you're affecting the ability of thromboxane A2 to secrete the noxious material that it's secreting to cause the clump. You understand that? That's how that happens. So now you drop your platelet quantitatively. Your platelet are normal in quality, but the quantity is down. Okay? But you got to understand something. It has now been clearly documented. I told you the normal platelet is 130 to 400,000. Let me repeat that. You will not likely bleed spontaneously unless your platelet is below 20,000. That's been scientifically documented. You will not bleed spontaneously unless your platelet drop below 20,000. But that said, there's a whole bunch of stuff you could do to yourself that will cause you to bleed even if your platelets are 100,000, such as taking aspirin, such as taking NSAID, such as going for surgery, etc., etc. Okay? So, if you are challenged, namely, you get caught, you get traumatized in some way, or you were taken to surgery, you had ITP, somebody didn't know, you're going to bleed like nobody's business because your platelet is too low, okay? We have certain level of platelet we could use to operate on people, on certain level we don't. We have certain level we could use to do biopsies, some level we don't. I'm not going to get through all this detail for you. Suffice it to say, now, the symptoms. The symptoms are, the first set of symptoms are bruising, easy bruising. It doesn't matter the color of your skin, you're going to see a bruise. You did nothing. You can't remember what you did, but you touched this chair, that causes your elbow to bruise. That's kind of strange. You cross your legs, keep it crossed too long. When you take it up, there's a bruise. And then you suddenly realize that you have a little bit of little punctate dot throughout your legs, your arm, over your legs, over your arm. We call them petechiae. Okay? Or suddenly you start bleeding from the nose for no reason. You didn't have a cold, you didn't pick on your nose, suddenly you start bleeding from the nose. And you did nothing in your mouth, suddenly you start bleeding from your gum. Then you could bleed from the rectum. You could have excessive vaginal bleeding or vaginal bleeding for no reason in between periods. You could have blood in the urine for no particular reason. Suddenly you went to urinate and there's blood in it. Or you could take it over your eye. You say, oh my goodness, your sclera is bloodshed. You see, the white is now red, spontaneous bleeding in the eye, and so on and so forth. And God forbid, you could also bleed into the brain. Okay? And it has been known to occur. So this is how serious this ITP thing is. Very serious thing. It's even more serious because we can handle the ITP as a disease once the diagnosis is made. No question about it. Much more easily now than we could 10, 15 years ago because we have better medication. The bigger problem is you don't know you have it. So you take it upon yourself to do a whole bunch of stuff which people do normally. And suddenly you get yourself into trouble because your platelet was low, you didn't know. But if you pay close attention to the bruising, to the petechiae, you can't miss those. Then that should raise a red flag for you to call the doctor to say, something is wrong. I'm getting all this thing over my skin. I need to come in for you to check it out. But if you ignore it and you go about your business and you start doing all these strange things that people do to themselves, if you drink too much alcohol, because alcohol itself affects the platelet. And now you're drinking it too much, it makes the platelet function. Now you already have a quantity of platelet issue. Now you're going to create a quality of platelet issue by over consuming alcohol and develop cirrhosis of the liver. Because cirrhosis of the liver by itself has a whole complex way of causing bleeding, which I will be getting into probably next week because the list of things that can cause bleeding is so long, It will take me months to go over them, which doesn't make much sense, but I will talk to you about those that are more common, that you may be more familiar with because you hear more about them more often. Okay? Because 30,000 folks develop ITP every year in this country, so that's a lot of folks. Okay? Some of them are people that family members of yours, friends of yours, etc. So it is a very serious thing. The key thing is, especially now with the internet, which is a great invention, but people abuse it by trying to self-diagnose themselves as well as self-treating themselves. And it's very dangerous. Be very careful about what you read on the internet. You have to be very careful. Some of this stuff is very good and very valuable, very important. I use the internet myself. I do a lot of research on the internet. But I know how to sort things out. I'm a physician. I'm an expert in the medical field. I can sort the junk stuff from the good stuff. I mean, it is amazing that people come into the office, even before they get there, they already made their own diagnosis. When they come to talk to you, you're sitting there, they're giving you all this stuff, rather than allowing me to, or my colleagues, other people like me who practice medicine, to get the information out of them that are really valuable. They already have their mind contaminated with the junk they read on the internet and thinking that's quality medicine. It isn't. Most of the time it's not. You have good quality stuff that are being said on the internet every day, 24/7. But you have more garbage than you have good quality stuff. Okay, so you got to be very careful not to risk your life by getting yourself involved too much in this stuff. That's doctors are there to help you out. Make sure you give them a call when you have an issue. If you don't have a doctor, go to the emergency room. Go to the emergency room, they'll take care of you, and they will suggest you a doctor to you. To have a doctor, call the medical society of the community where you are living in. Their policy, they'll give you 3 names of 3 doctors that they have high respect for, high regard for, and you pick one of them. That's the way it's done. You just move in the community, you haven't gotten hooked up with a physician yet, go to the insurance company, take a look at the book, see what doctors and what specialty that's in your neighborhood that may be able to help you. You're not certain, call the insurance company. Because the insurance companies profile us all the time. I have this ridiculous company that's been in existence now for the last several years. Every 3 months, they send me this piece of garbage that I have to be re-credentialed. Every 3 months. Now, and you can't make this thing up. There is such a company that's surviving, making money, because they created this business. Instead of allowing the insurance companies to do the credentialing themselves every 2 years like hospitals do, they decided they're going to do one more, one better. They're going to do it every 90 days. Now, what possibly could have happened in 90 days? They don't care. They absolutely don't care. They keep sending you this stuff. You got to fill out this ridiculous questionnaire, or you got to let them do it for you online. They're making a living. I have no qualm about people making a living, but some of it is really out of control. Really out of control. I mean, it's really completely, totally taking advantage of people and abusing them. Yesterday, an insurance company that I will not name rejected a month's supply of Amelioride HCTZ, which is medication we use to treat blood pressure. It happens to be the very best medication to start somebody on who just got high blood pressure, who has good kidney. Ladies and gentlemen, the medication costs $5 a month. $5 a month for 30 pills. I spent more than an hour on the telephone. They won't let me speak to the medical director, so-called. The next day, yesterday, I got a rejection. You can't make this up. A rejection, and the reason for the rejection, because this company has a formulary, which is a list paper list like that that has a bunch of generic junk they put in there. They call them medications. And that's what you got to go by. And ameliorate ACTZ is not on the list. Because it's not on the list, the medication was denied to the patient that cost only $5 a month. You absolutely, completely can't make this up. And it's just as true can be. When I called the patient to let her know that her request for prior authorization for ameliorate ACTZ that cost $5, when I originally talked to them, because years ago when I wrote it in one of my books, I think it used to be $10. So I was mistaken. It's now $5. It was denied. They're taking these people money. They insure them. They denied a $5 medication. I mean, you can't get anything cheaper than that. As a matter of fact, I think, I may be wrong, but I think it is the cheapest medication around. That is you prescribed, $5 a month. It was denied. And you should see, I received 4 sheets of junk that contain the reason for the denial and to cover the state law, the federal law, etc., etc. Okay? This is the world that we're living in. And doctors all over the country have to go through this nonsense all day long without pay, fighting on the telephone with people who don't have a clue what they're talking about. And you got to deal with these folks. And God forbid, if you're not nice to them, then they give you even a harder time. In any event, enough of my complaints. I'm stopping here. Next week, I'll continue to talk about ITP. Until such time, keep watching the show. This is Dr. Alcena saying so long and bye-bye.